Hello, I'm Biresh Banerjee and welcome to this live Q&A about the Hantavirus outbreak. Like you guys, me and my team also have questions and we'll try and get as many answers as we can at this stage. I'd like to say hello to people who joined us already on the YouTube chat. That's what I'm looking at the moment. Hello, Leonidas, B9252. You had a question about what can we expect from this strain given that Hantavirus had a 36% mortality rate. That's what we're going to put to our guest. Hello as well to at Down Under and Old Enough to Know. There is Domina as well joining us, and Raditya Azka Setia One. I hope I got that name right. All of you guys are on this. So these are the names on YouTube. Join us on YouTube. Send in your questions. Just so you know, a lot of you have been sending us questions over the our various social media channels, and we'll be bringing those questions in as well. We'll try and get some of those questions answered in a moment from Thomas Hofmann. He's the man who's leading the emergency response, at least at the European level, particularly coordinating with the various states involved. He's at the European Center for Diseases Prevention and Control that's based in Stockholm in Sweden. You see him there. We will be talking to you. Thomas, thanks so much for making the time. I know you're a very busy man. Now, this is also the organization, the ECDC, that has an expert on board, the MV Hondius, and that's the cruise ship where the outbreak was first reported. And just to know where this cruise ship is currently, we have a live feed. There you go. That shows the location. That's the one that's blinking, showing the location of the MV Hondius at the moment. This is off the coast of West Africa. If you look closely, it is somewhere between the border between Mauritania and Morocco. I mean, I can try and show you on Google Earth. I have this open on my computer, and maybe the team can bring this up for you guys. There you go. So if you just follow the cursor there, so the cursor is running away. The ship is somewhere around here, and if I zoom out, you'll see what I mean. So this is basically off the coast of Mauritania. That's in German. My apologies, but Mauritanian is Mauritania. And if you go further north, just pull this down further, this is basically all of this is Morocco. So the ship ultimately needs to get here to Tenerife. That's part of the Canary Islands. It is currently somewhere around there, if you follow my cursor. Right, we'll keep tracking the ship as it heads towards the Canary Islands, where some more than 100 passengers and crew will disembark. There are protocols in place as to how they will be disembarking and where they will be going. That is something that we will try and find out as well with Thomas when we speak to him. Now, all that having been said, the WHO is already monitoring the situation, and it had a press conference on Thursday. And at that press conference, one fact was reiterated, that this isn't the start of a pandemic. Let's just listen to what was said in the press conference.
This is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship.
I think it's an important point to reiterate at this stage. This is not at all a pandemic. It hasn't reached pandemic proportions. There's some stuff that we know that we will try and ask Thomas about as well. But the chances appear to be that the way this virus transmits, the chances appear to be rather low that this might become a pandemic. But you never know. We're going to chat with Thomas about it. But before we move ahead, a quick recap of what has happened so far, a timeline, so to speak. And we'd just like to bring up a graphic for you that basically traces the route of the MV Hondius. And the reason we want to trace that is because with that route, you can generally trace how this pandemic, how this outbreak has essentially progressed. Let's start from the 1st of April. The ship departs from the southern point in Argentina from Ushuaia, carrying passengers. And then on the 6th of April, we'll try and bring that graphic back up. On the 6th of April, the first passenger falls ill on the ship. And it is on the 11th of April that that passenger unfortunately dies. Now, it needs to be mentioned that when the passenger first fell ill, he showed respiratory symptoms of a respiratory infection. Nobody could have imagined that it was hantavirus. Therefore, this person wasn't tested. And again, testing is something that we need to talk about, because how do you test for hantavirus. Anyhow, on the 11th of April, the passenger unfortunately died on board. On the 24th of April, the ship stopped in St. Helena, where the passenger's body was removed. And that is also when dozens of other passengers disembarked from the ship. Nearly 30 passengers disembarked, and so did the wife of this passenger. She took a flight to South Africa. She unfortunately passed away as well on the 26th of April. On the 27th of April, a passenger was evacuated from the ship. He tested positive on the 2nd of May. And the 2nd of May is important because remember, the first passenger fell ill on the 6th of April, and it was on the 2nd of May, nearly a month later, that hantavirus was finally confirmed. And then you also had another passenger, unfortunately, who died on board on the 2nd of May. The ship arrived in Cape Verde on the 3rd of May, and now it is heading to the Canary Islands. Let's try and speak to the expert that we have lined up. We have Thomas Hofmann. He is the head of Emergency Preparedness and Response at the European Centre for Disease Prevention and Control. That's the ECDC. That's the organization that's at the heart of the coordinating effort at the European level. Thomas, thanks for making the time. Thanks for joining us. Thanks for waiting patiently for this interview. As I understand, you have someone from your organization on the MV Hondius at the moment that is escorting the passengers and the ship that is on the way to the Canary Islands. Can you tell us what is the situation on board? What is this person telling you?
Yes, thanks. Yes, indeed. 2 days ago, one expert from ECDC boarded the ship. And yes, his task is mainly to support the crew, the safe procedures on board of the ship, but then also to interview all passengers to understand a bit the situation over the past weeks. And also, of course, to ask questions about their health status currently. And all this also to prepare a bit for the disembarkation of the ship. So what he reports that so far, I think the morale on the ship is quite good, especially now that the ship is again on sail. It's understandable that it's tough if people like in Cape Verde had to wait for many days without really knowing when it's continuing.
I mean, it's good to hear that the morale on this ship is good, given that, I mean, it's seen people die on this ship. I mean, people who are currently on the ship, the people who are sailing with, some of them have been evacuated, some have died. Can you help us understand what is happening in terms of, I don't know, health protocols on board? Are people being separated? Are people having to wear a mask? Are they undergoing daily testing? What is happening when it comes to all of that?
Yes, it's indeed a bit like what we know from the COVID pandemic. So passengers are advised to stay in their cabins. If they go outside, they should wear a mask. They should keep a distance. This is a bit how it's handled. And so far, I think it's also well accepted. I think everyone understands the risk on board of the ship. And also what the colleague reports, there's also very good collaboration between like the crew and the passengers.
There are already some questions coming in our community chat. Now, this is from YouTube. If you can just answer briefly some of the initial questions there. For example, this is from user at @itjustmelam saying, although human-to-human transmission of the hantavirus is rare, why is the WHO still monitoring the situation so closely?
I think that's normal for any disease outbreak. I mean, also we monitor the situation closely. So our colleague on board of the ship also collects all the data, captures also, yeah, kind of the profile of the people. It is very important, first of all, to understand the situation also for the future. We get to know the virus better. I mean, hantavirus, we know something, but we don't know all. On this strain, human-to-human transmission, we know a lot from Argentina and Chile, who know this, who have faced this situation every year. For them, it's normal. The rodent is present there, which is not in Europe. So for South America, I think this situation is a very regular one. Also, they monitor the situation. So there's nothing unusual. We, of course, need to monitor not only like the outbreak in itself, but also like each individual passenger, because as for any serious disease, the earlier symptoms are detected and diagnosed, the better the treatment can be provided.
Okay, there's a number of questions coming in, and I also have a number of questions based on just what you said. There is a question here from a user at ZILVI6HUM. I don't know how to pronounce that username, but this user is asking if we should begin masking. And also Siki Machan, one of our regular community users, asking if one is required to potentially take a vaccine once the medicine has been developed. I know that might be a question way into the future, but I thought I'd just ask it because it is certainly concerning people.
I mean, as Maria from WHO said, we are not dealing with COVID, we are not dealing with influenza. It's not a respiratory disease. It's not transmitted the same way. So even if it's being transmitted between humans, from human to human, it requires close and prolonged contact, intense contact. So even short contact does not lead necessarily to an infection. So that's also why 2 days ago we have published our risk assessment and very clearly stated, although we still expect some further cases appearing in the next couple of weeks, we don't expect this to transmit any further, because if proper measures are being taken, people are being isolated, contacts are being informed, there will be no further transmission chains.
Okay, can you just give us an update on where we are with the numbers? I mean, the WHO held a press conference, and we just heard from Dr. Maria a short while back in this stream. And in that press conference, the figures were 5 confirmed cases with 3 suspected cases. That was yesterday in the afternoon, on Thursday. Today is a Friday. As of now, how many confirmed cases do we have of hantavirus as part of this outbreak on this ship, and how many suspected cases? Do you have any numbers on that?
Yeah, we still, I mean, this changes quite frequently. We still have now the count that we are talking about eight cases in total, of which we have 3 confirmed so far, and the others are still suspected.
How can there be 3 confirmed when yesterday there were 5 confirmed? You mean 3 deaths, right?
Yes, of course. 3 deaths plus, yes, exactly. So 3 deaths plus 3 confirmed.
3 deaths plus 3 confirmed. So in total, so far in this outbreak, 6 confirmed cases, of which 3 people are unfortunately dead and 3 other are suspected, correct?
Yes.
I know it's a constantly changing situation. I'm just trying to get the latest that we have as of now. We're going live. I mean, and this is where maybe the question from Leonidas B9258 comes in, because he says hantavirus has a 36% mortality rate. I don't know if that is correct. Thomas, maybe you'll have a better idea. But the question is, what can we expect then from this current strain?
So to expect from this current strain, I mean, I said it's not a new strain, right? It's nothing new. This understrain is known. It's present. It's endemic in Argentina, Chile. Health authorities there have also developed protocols how to handle the risk. So in that sense, that's of course not applying for us, because as I said, in most cases, hantavirus transmits from animals to humans. Knowing that the rodent is not present in Europe, we also don't expect that it will establish itself in Europe, for example, or in any other continent. I mean, it's there in South America, where the rodent is present. Mm-hmm. And human-to-human transmission, well, as said, right? Yes, there can be further infections, but then with proper measures, this can be controlled.
Okay. Now there are questions also coming in thick and fast in the chat. I want to bring one of them to you. This is from user Jorge Andres. I'm sorry if I mispronounced your name. He is asking. I'm assuming he's a he. Please explain what exactly is the hantavirus. How is the transmission? What are the symptoms? Because none of this is clear. at the moment? Because especially when it comes to transmission, Thomas, people keep talking about close contact. How close is close? And what are the symptoms if you do get hantavirus?
Well, the symptoms are very normal symptoms, like we know from many other diseases. So some respiratory symptoms, some report gastrointestinal symptoms. So in the first place, it's not so obvious. But then now this Andes strain can develop this severe lung infection, which can also deteriorate quite fast. So that's, of course, talking about the symptoms. About the transmission patterns of the virus, we don't know everything about the virus, but what we found also in the scientific literature and what we know from partners in Argentina and Chile, that normally the infection can occur with contact through like body liquids, and that can, for example, include particles from when patients vomit, can be urine. So usually can only really occur if people are in very close contact, sharing the same bathroom, things like this.
So it is not airborne in a sense the way COVID became eventually. I mean, if people sneeze during the COVID time, the particles traveled a certain distance, and those fine particulates could transmit the virus. That is not happening over here. Is that what you're saying?
Yes, that's not happening here. It's not transmitted this way.
Okay.
I mean, in theory, you could even sit on a flight next to somebody, and if there's not any kind of contact with any particles or liquids of that person, he will not be infected. Well, for somebody having influenza or COVID, this is unlikely. So, I mean, there's a huge difference when it comes to the transmission patterns.
Okay, the hantavirus per se is not new, and neither is the Andes strain of it. I mean, it's been seen in South America, as you said, Argentina, Chile, you were talking about. Therefore, just to bring in a question from our user at Big Fish, asking, does this mean that the WHO has a hantavirus vaccination? Is there a vaccine against hantavirus, given that this already exists, the virus already exists, or how does one work with it?
There is currently no vaccine available. I heard that, yes, there's efforts in place to develop a vaccine. But coming back to what I said earlier, right? It's of course, the question is, or probably there's also the question of the need. I mean, I don't expect, for example, based on the risk assessment we published, that there's any risk for other continents than where it's currently present. So, of course, maybe countries like Argentina, Chile, they might consider a vaccine, but where it's not endemic, it's unclear if a vaccine at this point would be very useful. I mean, we also have to consider that, of course, the circumstances now on the cruise ship were very special, like people sailing since 1st of April in a confined space over several weeks has only resulted into the currently known number of contacts. So we clearly see that even despite this type of contact, despite of shared living, it did not lead to much. So that for any vaccine, always there's a cost-benefit analysis which needs to be done, and which is, of course, in the end up to every also member state to take such decisions. But in the end of the day, from a public health perspective, as we see it now, there's no risk.
Okay, thanks for answering some of those questions. There's a question here that I myself can answer. There's at least something that I can answer. This is from @Zilvi6HU asking, didn't one of the flight attendants get sick from the Johannesburg flight? I mean, the update there, dear user, was that this flight attendant tested negative for hantavirus, although she was in the hospital. So that is an update that I can also provide our community. But keep your questions coming in. We're trying to bring in as many of them as one can. There is something that I did want to ask you, Thomas. I mean, this is a rodent-borne disease or a rodent-borne a virus, and somehow it has gone from rodents potentially to the first patient. If we assume as this person is being called patient zero, I've seen that reference being made in the past few hours. How did it go from the rodent to patient zero? Because if it is through rodent droppings, does that become airborne in some fashion and then enters the respiratory system of a patient? How did that transfer happen?
Yes, I mean, definitely we have this assumption that it has really been acquired by those first cases while being on land, probably in Argentina. We know that this first couple affected, they had traveled several weeks through Argentina. How it exactly happens and can happen, again, it requires close contact with animals. We know, of course, that anyone who was on that cruise ship, it was about bird watching. So even before, we could assume that probably those individuals were very interested in wildlife. We don't know exactly what they did throughout their journey, but there must have been some kind of closer contacts with either animals or excrements of animals. But yeah, I mean, this is unknown to us.
Right. Can you talk a bit about the contact tracing? And that is something that was mentioned in the press conference of the World Health Organization on Thursday as well. As I understood, listening to that press conference, people who might have been in contact with those who were on this cruise and are now on land, countries are trying to trace people who might have been in touch with them. But what does that mean? Because in the middle, you had about nearly 30 passengers who disembarked on the island of St. Helena. That was, I think, in mid-April or the latter half of April. Nearly 30 passengers over there, people who are in South Africa and who tried to get to continental Europe. There was a flight from St. Helena to Johannesburg. There's all these modes of transport in between. I mean, where is the contact tracing happening and how widespread is the case? Because we're talking about, I think, more than 20 countries, citizens from these countries who are on the ship, either in the form of a crew or passengers.
Yes, indeed. I think it has been confirmed that this group left the boat. I think it was also planned, right? This whole cruise was a bit of a hop-on, hop-off cruise concept, so people could leave the boat, get on the boat. In the meantime, all those passengers have been informed. The local public health authorities are now working with those passengers to really make sure they know to monitor for symptoms, to report symptoms. Close contacts have been informed. And this is apparently key for any behavior to really understand the social interactions during such times when it's not known if infection has occurred.
Okay, let's get a question from TikTok from user @Shortney, who is asking, why are they letting passengers off the boat? I don't know how you feel about getting that question, but that is something that people are asking.
Yes, it's, I think, a valid question, but I don't have any answers for this. I mean, as said, right, the whole concept of this cruise was like this. People could hop on and could hop off, and probably the passengers booked the trip like this, that they would disembark in St. Helena, but that we don't know.
Okay, there's a question here that potentially I can answer and give you a bit of a break, Thomas. This is from Jorge Andres, who's asking, how many people are in the boat? It's close to 140. Is that correct, Thomas? That's how many people are on the cruise ship at the moment?
Yes, I think we should, right now, there should be 151, I think.
151, okay.
Oh, 150 maybe, 150 probably, taking into account the team which boarded now, the health professionals boarding the ship and the others leaving the ship.
Right, and it just needs to be made clear that not everybody has hantavirus. I mean, but that's just the number of people who are on the boat. There's some questions also coming in about the mutations. We're talking about the Andes virus strain here. Is there a fear that this will mutate even further, or does it stay as it is?
Well, any virus can mutate, that we know, but we also know that different viruses mutate in different time spans. I mean, some viruses mutate faster. We know this from influenza, for example. For the Andes strain, it has been around for some time. We haven't seen any recent mutation, so we don't really expect something in this direction.
Yeah, just to answer people in the chat from Watt, Tyler, but Victorious, no, we don't see our own questions. We see your questions and we try and bring them into the chat as best as we can. There's a question that has come from a user at Sampanna. This is on YouTube, Thomas. Has any case been found outside the cruise ship? Can you tell us about where the latest confirmations have happened?
Outside of the cruise ship, well, that's a good question. I think, yes, you mentioned before the flight attendants, where then the test was negative. I think there was again last night in Germany a report of somebody who was then tested also negative. I think as of now, at least from sources we are monitoring, we don't know any further confirmed cases outside of the ship.
So just to answer this question from user at Barangs on TikTok, who was asking if there are any cases in Asia, the answer at the moment would be none, correct?
Correct.
There is a question that's coming from Bean Smoosh, and I think you are uniquely placed to answer this, Thomas, because some cases have been confirmed in Europe, particularly in Switzerland, I believe, in Zurich. The question is, what exactly is Europe doing to prevent the spread of this virus? And you are in a coordinating position here, coordinating the responses across nations in Europe. So what exactly is Europe doing to prevent the spread of hantavirus?
Yeah, I think what happens right now, and yes, sorry, yes, I forgot the case in Switzerland. Clearly, I think there was this was confirmed. What happens in Europe? I mean, I'm speaking now more for like the EU part of Europe, where the European Commission has this health crisis management body, which is composed of all EU member states, representatives from ministers of health mainly, and the European Commission as chair. They discuss measures, they discuss how to coordinate, they discuss also how to prepare for this disembarkation of the ship, and then the further treatment and support of the passengers in their home countries.
Okay, can you talk to us about what is the protocol really here for people? I mean, this is something that Siki Machan was also asking, like what kind of contact should be avoided to prevent ourselves from getting the virus. What is the advice here to individuals? I mean, if you feel like you have something of a respiratory infection coming on, should you stay at home, isolate? Should you wait for 6 weeks? Should you go and get a test? What is the protocol there for individuals now?
Yes, we stated in our risk assessment, as the risk for the general population is extremely low, we don't think that any current practices should be changed. If somebody feels sick, seriously sick, then of course it's always advisable to seek medical treatment or to visit a doctor. But in line with our assessment, we would not expect that anyone who has like a minor cold to now seek the doctor just because of this. Yes, that's it's as said, all of those passengers are being followed. So anyone who already left the boat people self-monitor themselves, they self-isolate them, so they also just don't move freely around. So there is also no exposure in a way how we see it, or it's negligible.
Okay, like with COVID, and maybe it's a false comparison, but that's the last pandemic that people experienced. And just to clarify again, this is not a pandemic, and this is very different to the way COVID transmits. But then people could take a test, right? I mean, you could purchase a test from the local pharmacy, and you could see whether you have COVID or not. Although hantaviruses have been around, and the Andes virus has also been around, what is the testing protocol there? Can you do a test yourself using something from the local pharmacy, or do you need to go to a proper laboratory and then that laboratory diagnoses you? And how is the testing being carried out in Europe, for example? Is that being done with major laboratories, or can people who are self-isolating test themselves?
Yes, good question, but also quite complex. I mean, generally, you can also, like we know from the COVID times, right? It can be tested through nasal swabs. It can be tested through PCR. We do not advise any serial testing at this point in time. There's also no need for it, as said, because we don't expect further transmission, widespread transmission. If an individual would require a test, the medical professionals would advise to do so. So possibilities are there. It's easy to test, but we don't. I mean, there's no need for a massive test strategy at this point.
It's great that you're remarkably calm, and that's probably because you're aware of all the facts. I don't think anybody's panicking as such. So, but all the questions are coming in because these questions are concerning people. So it's good that you're being able to clarify them as we go along. I mean, there's another from the same user, Barangs on TikTok, asking, can this be diagnosed via a blood test? Is that a possibility?
Yes, also. I mean, there's of course different ways to test this in laboratories, but yeah, it really depends on the assessment of the individual situation whether this is required or not.
Just some questions coming in about the fatality of this. I mean, user at a.door or Dore on TikTok asking, how fast does this infection become fatal? And user Jorge Andres also asking, the mortality rate is only if the illness is not treated, right? Is there any treatment to reduce death as an outcome? So basically two-parter, how does it become fatal? How soon does it become fatal? And is there any treatment to prevent that fatality?
Early treatment is always the best. So the earlier symptoms are detected, the earlier treatment kicks in, the better the outcome. Treatment in that case, well, there's no approved pharmaceutical at this point in time or available, but there's supportive treatment, of course, for any of the body functions. So the sooner this supportive treatment can happen, the better the outcome.
Just one final question. I know you have a number of meetings to attend. This is another basic question, but maybe it helps all of us understand and get to grips with what we're dealing with. This is at Daniel Gill 1277. Can you explain what hantavirus actually does? What does it do to the body?
I mean, this Andes strain causes this cardiopulmonary respiratory syndrome, which of course can deteriorate quickly. It's the severe lung infection I was mentioning before. Yes, how quickly this can deteriorate, that depends also a bit on the conditions of the patient. I mean, generally, if there's other diseases the patient is suffering from, age can matter. So there's a few factors to consider. There's no clear pattern.
Okay. We'll leave it there for the moment. Thomas, I know you have a number of meetings to attend. You're, after all, coordinating the entire European response Yeah, thanks so much for joining us, Thomas Hofmann, Head of Emergency Preparedness and Response at the European Centre for Disease Prevention and Control, the ECDC in Stockholm, Sweden. Thomas, thank you so much for your time. Thanks for answering these questions.
Thank you.
I wanted to bring you an update on the latest developments in this particular case, but I also wanted to bring in a sentiment that user Sarah Taylor 456 on TikTok has shared, and I think a lot of us can associate ourselves with this sentiment. She says, "I'm a nurse in the UK. I don't think I've got it in me to work through another pandemic." I think that is a sentiment and a fear that a lot of us feel. But just to clarify that the World Health Organization has said that this is very different to COVID. It transmits very differently. It is not a pandemic, and we are not at that stage as yet. Let's just bring you an update of what the latest developments are in relation to the Hantavirus outbreak. The WHO has ruled out that this is a pandemic. It is not a pandemic. Several cases of hantavirus have already been confirmed, and there have also been 3 deaths. A KLM flight attendant who reportedly had contact with one of the sick cruise ship passengers who later died has tested negative for the virus in the Netherlands. The MV Hondios ship is currently traveling to Spain's Canary Islands. It's expected to arrive in the coming days. The roughly little more than 140 passengers and crew members will be evacuated from the island of Tenerife in the Canary Islands to their respective countries. That is it for this live stream. Thank you all for joining in and sending us your questions. Like any live stream, we try and get to as many questions as possible, as many concerns as possible. I hope you will be at least mildly satisfied with the number of questions we've been able to answer. This is not the final time we'll be looking at this story. We'll be following all the latest developments and bringing them to you either as a live stream or as other forms of broadcasting. Stay tuned to DW.com. Thanks for sharing your insights and experiences. Thanks for everybody else who sent in their questions. Thanks for your active participation. We look forward to talking to you again on another live stream, potentially. If not live stream, maybe a different form of broadcasting. But thanks so much for today. We'll see you soon. Bye-bye.